Hello and welcome back to the Armor Men's Health Show. I'm Dr. Mystery, your host, joined always with my co-host, Donna Lee.
That's right. Happy day, everybody. Welcome to the show.
Many of you may not know, but Donna Lee is a professional comedian, and we can't wait for her to get back to the stage.
Yeah. Okay.
Is it going to happen anytime soon?
I don't know. The local group got bought out by a national group, the comedy club.
Yeah.
I don't know anybody at the national group, but I had my friends at the local club. So
I'll put a word in, and Joe Rogan, I'm sure you're an avid listener.
right.
Maybe you could put a word in too for us.
You can visit my TikTok page. It's Donna Lee Happy. That's my handle, Donna Lee Happy. I'm doing my jokes on my TikTok page.
Very good. Please do not visit our TikTok overlords. The
You
Chinese have enough information on us.
Your own TikTok. It is Mystery Doc on TikTok.
We are joined again by Dr. Kenneth Kernen. He is a urologist in Michigan, and he and I crossed paths when he was a fellow at Baylor College of Medicine, the finest university. And we just had a segment earlier on enlarged prostate, use of medication, and traditional therapies. But one of the main reasons I wanted to have you on today, Kenneth, is to talk about some new and exciting technology when it comes to BPH. Why don't you set the stage for us and tell us why was something needed new in the first place?
Great question. I think, like anything, men have worries about having their prostate treated, whether it's, infections, bleeding, sexual side effects, which I think is probably the most important concern for most of these guys. Is they want to make sure that everything still works when they're done. They want to be able to urinate better, but minimize any risk of sexual side effects. So again, I think that's where that almost reverse engineering of, hey, if we found the perfect thing, how do we have no sexual side effects? How do we make people urinate better and then make it work? And that's kind of where we are today with some new technology.
So if you were to kind of like define for both doctors and patients, what would be the perfect set of things that could occur for an enlarged prostate? We would have something that is quick. We'd have something that's painless. We'd have something with no sexual side effects. We would have something that has no catheter, and we would have something that's permanent. And I think that those would be kind of the things. And there's no solution that's perfect. Unfortunately, that's taken them all, or else we'd only have one solution. The sexual side effect component of it, which is the dry ejaculation that can occur, is something that has been a bigger issue for patients than I ever thought would be for them. Now, so when it comes to this newer technology that we're going to talk about, what are some of the main highlights that it hits? What are some of the problems that it solves?
Well, honestly, other than discomfort, I think it solves all those problems you mentioned, right? So these new procedures are very quick. They're very simple. They minimize the risk of bleeding, infection. You don't have to have a catheter, and really no sexual side effects, whether it's dry ejaculation or any erectile dysfunction, which again is rare during a standard prostate resection, but it's not zero.
So when you're talking about this new technology, why don't you introduce it and tell us what it is?
Sure. So it's really called the iTind, iTind. It's from Olympus. It's a non-permanent implant that we put in when the patient either has some light sedation or some local gel that's put into the urethra. It has rapid symptom relief. It stays in their prostate for about 5 days. It opens their prostate up significantly. They don't need to have a catheter. We take it out in the office 5 to 7 days later. They immediately urinate better, and they have zero sexual side effects. The only thing that we miss a little bit is it's a little bit uncomfortable, but not terrible.
So if you were to kind of, because I'd like to hear your explanation, then I'll tell people what I explain to people as I tell them, and then maybe you'll start using mine, although I'll charge you a royalty. So how do you describe like what the technology is and what it looks like and feels like deployed to your patients?
Yeah, I actually, since I put the first ones in the country, I have a couple laying around my office. So I break that thing out and I show people. But I tell them it's almost like a Mercedes-Benz 3D image that we're putting in your prostatic fossa. And over those 5 to 7 days, it actually expands in all three of those directions, makes permanent incisions in the prostate gland and remodels the prostate gland. And then we compress that and take that out. And it's like it's a nitinol wire.
That's good. And so what I explain to people that it's like an expandable scaffolding that we put into the donut hole, and it pushes the walls out in a way. And if it stays there for 5 days, the little grooves that it makes because of the scaffolding are actually kind of bit into the tissue, and it creates these grooves that you can urinate from. And this is it utilizes a fascinating component of biologic tissue called pressure necrosis. That is where, if you really, any part of the body biologically, if you push hard enough for long enough, the tissue dies underneath and you get an indentation. And so that's a very neat part of the process. What are some of the kind of obvious benefits you get from using pressure necrosis over an incision to do this?
Right. So great question. I think the big benefits is, number one, very minimal, if not, or no bleeding. That to me is the biggest one. Because it's such a gradual process, the discomfort level is very minimal. So it's not like a TURP or a resection where they're going to have a little bit more discomfort. So, and the other thing is, because it's gradual, it doesn't create a ton of inflammation. So they also don't need a catheter. So I think that's a big thing for our patients as well. We can do this procedure for patients without a catheter. That's one of the things that they worry about almost as equally or maybe a little bit more than sexual side effects.
That's right. I mean, men are really afraid of having that thing shoved in their penis. So when it comes to this type of iTind device, you guys are doing it in the office?
A lot of things, as you know, are sometimes dictated by carriers and insurance companies, right? We always joke that we have equal enemies, patients and doctors, which is the insurance companies. So we're always kind of fighting that battle. So I think it's very amenable to be done in the office. Right now, from a reimbursement standpoint, it's not perfect. So we're normally putting these in our surgery center. But I think as the carriers and the government gets on board with how great this device is, they're going to encourage us to be doing this in the office, because we can do it with a flexible cystoscope or a flexible telescope.
So tell me, who are the ideal patients for the iTind device, which is provided as a service here in Austin, and in multiple places around the country? You can go to the website. Do you know the website off chance?
You can actually just go to iTind.com.
Okay, so iTind.com will have like a way to look for providers.
Or Olympus.com. I'm sorry. They also have it.
Okay, so in terms of the type of patient that's a good candidate and one that's a bad candidate for the iTind, why don't you go through that?
Sure. So obviously, it's intended for those patients who have urinary obstructive symptoms. Those symptoms obviously should be bothersome to the patient. But from a perfect kind of candidate, I always joke that if this is interesting to you as a patient, we have to measure you like measuring you for a suit, right? So we wouldn't put on the same suit as you, me, and Donna. We'd have to measure them to make us look good, right? So we say you need a couple things. We get them a prostate ultrasound, we do a flow test, we look in their bladder, and that ideal candidate has a prostate somewhere from 20 to up to 75 grams, no median lobe or no part of their prostate that's sticking up into the middle of the donut. And that's really and they shouldn't have a neurogenic bladder, meaning their bladder should function normally. That's really the perfect candidate.
So you want somebody that has a bladder that's strong enough to pee.
Correct.
You want somebody that has a more traditional growth pattern of the prostate, where the lobes are squeezing from the sides. What about use of blood thinners? Is that something that precludes you from getting this procedure?
I don't think so at all. In fact, because of the pressure necrosis and the no incisions, we have done a couple of patients who really couldn't be off blood thinners for an extended period of time.
And sometimes we'll come across that somebody who recently had a cardiac stent or has a high bleeding risk due to blood clots in their legs. We are going to be reticent to do something that may cause a lot of bleeding. In terms of the longevity of these procedures, how do you counsel patients, and what have the studies shown?
So it's interesting. There's a couple other reasonably good, minimally invasive, quote, competitors out there. One uses steam. One uses a stapling device that pushes the prostate open. that data is all, if you compare all their data at 3 to 4 years, it's all really good. It compares favorably with a traditional resection of the prostate. We just don't have a lot of data past that 3 or 4 year mark because it just doesn't exist because those procedures haven't been out there that much. But if you look at the other two other competitors, iTind actually leads the category from changes in IPSS score, which is the symptom score that patients have. It leads the pack in flow rate, changes in their residual urine. It leads the pack in retreatment rate, so it's got the lowest retreatment rate. And then it also definitively leads the pack in lowest risk of having a catheter. So kind of across the board against its competitors, it's pretty durable and I think leads the pack.
That's great. You know, I've done quite a few at iTinds here in Austin. We've had very good results. If you're looking to be seen, if you're a candidate for it, I go to that's the letter I, Tind, T-I-N-D. This is not the kind of radio show in which we get any kind of advertising dollars. This is truly just kind of, despite all my requests from Donna to start getting some. But despite that, this is just kind of our own experience. Ken, thank you so much for joining us and giving us your insight. You're somebody who I have so much respect for. I appreciate your insight today.
Hey, thanks so much. I really love being on it. Great to see you again. Go Baylor.
Thank you, Ken.